Hi, everybody. I'm not going to be presenting a paper today, but I am going to talk about the South African experience of actually trying to target a vulnerable population in response to the COVID pandemic. And at the time, the government drew on the research of SELDRU and DPRU, two research centers at the University of Cape Town. But ultimately, the population that is targeted is very much determined by practical considerations of what was deemed affordable and what data was available to us at the time. South Africa has a large poor population that relies heavily on an extensive social protection system, which was already in place at the time of the COVID pandemic. 40% of the population lives under the South African, the Stats SA lower poverty line, which is defined as 1,109 Rand in 2024 prices, and more than half of the population falls under the upper bound poverty line, where 1 Rand is equal to, or rather 1 euro is equal to about 20 Rand. 33% of our population does not have a job, and if you look at the expanded definition, which also takes into account people who want jobs but are no longer searching for jobs, then it's as high as 43%. The COVID-19 pandemic really tested the resilience of the social protection system that we had in place at the time. And when we introduced this special grant for people who are also of working age, the social protection system peaked at 32.3 million beneficiaries in April 2024, out of a population of 63 million people. We had to revisit at the time our understanding of what classified as vulnerable. So where typically we've thought about this in terms of people who are able to work or not able to work, COVID meant that people who were participating in economic activity were no longer able to engage in that economic activity, and so even the employed population or informally employed population became vulnerable. But in South Africa, even outside of the pandemic, we have what we term the working poor, where you have people in jobs earning a salary or some form of income, but that does not constitute enough to sustain the well-being of their households. When shocks like COVID hit, or climate shocks, for instance, the circumstances of these buckets of vulnerable people change, and their impact, and this impacts earning potential. And so the need to adapt your target of who is vulnerable becomes very clear. At the time, the South African government mounted a rapid response which shut down economic activity and mobility. We understood that this would affect the unemployed and underemployed informal workers, where employed people were expected to benefit from contributions to an unemployment insurance fund, with about 8 million people registered for that benefit. Those in the informal sector would be left without any means, and informal employment in South Africa constitutes about 20% of total employment. Trying to target vulnerable populations during COVID-19 revealed the challenges of effective targeting while still trying to ensure the affordability of interventions. And it exposed the limitations of our system when it comes to targeting. This did, however, lay the ground for progress that is now underway in terms of digital transformation to help us more accurately and efficiently target those in need, and for that to be adaptable as circumstances change. This is of particular importance if you look at our indigent populations, which are people who rely on the government for free or subsidized basic services. And in South Africa, the National Treasury spends almost 60% of its non-interest spending in the budget on what we term a social wage, which is expenditure that goes through public transfers through education, health services, social development, and so on. Municipalities are required to register indigent households and to have a list available of these beneficiaries, but these indigent registers pale in comparison to the number of grant beneficiaries who are paid from SASSA on a monthly basis, the South African Social Security Agency. And this is this is important for the financial sustainability of municipalities in South Africa, many of which are in crisis, because being able to differentiate between a customer who can pay something towards the services they receive versus nothing at all is ultimately part of the models that they rely on to be able to raise revenue to deliver those services at all. So during COVID-19, we introduced a special grant, and in determining who would receive that grant, there were a number of challenges that we had to consider. The one was that the size of the universe of informally employed differed depending on how you calculated it. If we took the entire population and excluded those who were formally employed or those who were receiving social grants of any form, and to do that, we relied on data that was available from the Unemployment Insurance Fund, from the South African Revenue Service, from the Social Security Agency. Then you were left with a universe of people of about 15.8 million. But this was, at the time, deemed unaffordable. And so in order to further reduce that number and to target to take a more targeted approach, we considered different mechanisms to do that. One was limiting the age range from 18 to 59 years to 21 to 59 years. And this was on the assumption that most people at the younger end of the spectrum would still be attached in some way to a household that would give them some access to means for survival. The other, which was ultimately introduced, was excluding upper income deciles. And this was done by designing an income threshold means test, which would exclude anyone with an average income balance of more than 3,500 Rand, which is the median income, about the median income in South Africa. And this left us with a population of around 8 million people. We also considered targeting areas of multiple deprivation, but because we needed to institute something in a very short amount of time possible, that was not deemed an appropriate or effective strategy. And of course, not all people live in poor areas. So the grant that was introduced was 350 Rand to address the gaps left between the upper decile, where they would still have some form of income support, and the lowest decile, where you would have access to some other form of social grant in your house. And this was based on the rationale that there would otherwise be a dramatic poverty effect from the loss of income for deciles 3 to 8, basically the middle of that spectrum. How we actually instituted the targeting was to rely on a hybrid of a push and pull model. So in South Africa, we don't have a universal social security registry, or we didn't at the time. And so from the pull side, we asked people to self-identify by registering on a platform, and this made use of mobile technology, and they were then authenticated through that platform. And on the push side, we used administrative data from our Home Affairs database and then removed those people that featured on the other databases that I mentioned, either because you were in work and were paying for an unemployment insurance fund benefit, or because you received a grant of some form, student funding, child support grant, and if you were paying tax and your information was captured in our revenue service database. And then in addition, we added the means test for income, which in the beginning was quite a rudimentary exercise and has since subsequently been shown to have as much as 50% of fraudulent applications. And that was because we simply tested the income in the bank account that you registered with, whereas we have since moved to a more sophisticated approach that looks at all bank accounts linked to the ID number. We learned a number of lessons in this process. We revolutionized the onboarding process by using digital technology. We automated the verification of beneficiary information and the decision process, and we developed the first comprehensive interoperable data set drawing on the various administrative data sets that we had available, and were able to institute that means test. But I think most importantly is that it laid the foundation for the work that is now being done, where government is developing a digital identity system for people to securely and remotely access services with universal biometrics, a master social security register, if you may. And this will help us to address fraudulent applications, to institute criteria that are able to hone targets more specifically, like for instance, if someone is themselves unemployed but is married to an employed person, should they also be excluded? And ultimately, it will also be possible to assess need at the household level. So the first phase of this work is expected to be complete by 2026, but it is ongoing. Yeah, let me stop there then.